Okay, I'm going to go ahead and get started, and then people can jump in and out as they need to. And so I'd like to welcome all of you here tonight. My name is Renee Wall, and I am the Director of Alumni and Family Engagement here at Carroll. We are so lucky to have the nursing department being willing to be our first of the academic highlight events. Also our guinea pigs in how we use this technology. I'm going to start off first by saying I am not a technology wizard. And so if I mess something up, just bear with me. I'll get you back to where we should be. Just a little bit of housekeeping. Down in the bottom, some people are used to using the chat to ask and answer questions. If you'll notice a couple tabs over, there is a question and answer tab. That's where you can answer or ask questions. They will come into me as the moderator, and then I will go through and forward those questions on to others. Tonight, just to give you a brief overview of what the program will look like, we'll have Dr. Seck start off the program with a brief welcome, and then I'm going to have our panelists introduce themselves, tell us a quick little bit about themselves and how they came to be associated with Carroll. Then we're going to move into a very brief video on the nursing department. I'm going to bring it back to our faculty and let them tell you a little bit more about what the video doesn't cover. And then we can go into a question and answer session. I'm also going to tell you that for as long as I've been at Carroll, and it is a very long time, I am not an expert at all things Carroll. We probably all may not be experts at all things Carroll. And so if there is a question that's asked that we can't answer, just know that I will get back to it. I'll get you that answer. It just may not be immediate. And so with that, I'd like to invite Dr. Seck to just give us a few words of welcome.
Well, thank you, Renee. And I guess I would say, I think if anyone at Carroll College is an expert on all things Carroll, you are pretty darn close. Especially with the retirement of Candy Cane. I think you're very close. So
are you calling me old?
No, of course you began working at Carroll when you were about 11, right? So, but I'm John Seck. I have the pleasure of serving as the president of Carroll College, and I just want to say welcome and thank you for being here tonight. And also just want to say thank you to our wonderful Office of Institutional Advancement and their colleagues and partners for pulling this together. I think this is absolutely fantastic. I'm actually speaking to you tonight from the Great Northern Hotel here in Helena because I was here representing Carroll College tonight at the opening or the announcement of the new benefice medical facility here in Helena. And they had probably a good couple hundred folks here from around Helena and the region. And the reason I mention that is because I cannot tell you how many people visited with me tonight about our Carroll College students, our Carroll College alumni, and different businesses and industry who have hired our graduates and have just said, Carroll College graduates are the best. Carroll College nurses are the best. Carroll College doctors are the best. Carroll College accountants are the best. I mean, on and on and on. In fact, the original plan was that I would actually be able to beam into this from my office. And I wrote Vice President Imony and said, I don't think it's going to work out that way because there was so much interest in Carroll College. So thank you for being such engaged and involved members of our alumni. I know you're going to have a wonderful time tonight learning about our nursing program. It is the best. It's the best, I think, in the United States, and we're very fortunate to have it. And so look forward to the evening, and Renee, I'll turn it back to you. And as always, when I have the pleasure of greeting alumni, I always end by saying, go Saints. And don't forget, I have to say this, don't forget tomorrow at 2 o'clock, the Carroll College Fighting Saints women's basketball team will be taking on Morningside in the Sweet 16 national playoffs in Sioux City, Iowa. So check it out. Back to you, Renee.
Thank you so much, Dr. Sack. And as I shared with people earlier, if you do have to leave, we fully understand you have other commitments tonight. So thank you again for being with us. For the panel, our great panel that are here tonight, I'm going to go ahead and ask you to introduce yourselves. And I'm going to ask Krupa to start it off.
That's me. Hi, I'm Krupa. I am a junior nursing major with a business administration minor from Medford, Oregon. And I guess I was led to Carroll primarily by chance. I actually ran into our regional rep, Ty Eastbach, my senior year of high school, by accidentally spilling my water on him. And he was like, "Hey, have you heard of Carroll?" And I'm like, "No, I have not." So he kind of, talked Carroll up a little bit. I toured and I honestly just fell in love with the Carroll community and the Helena community in general. Everyone here just makes it feel like home, and it's continued to feel like home. So, yeah.
Sorry, I was on mute. Elias?
Hi, I'm Elias. I'm a sophomore nursing student from Coeur d'Alene, Idaho. And I came here because I wanted to go to a school where I could continue to do track and field, as well as go to a well-respected nursing program. And Carroll checked those boxes for me, so I got in contact with my regional rep and started the process of coming here.
Back to our faculty.
Hi, I'm Maria Brosnan. I'm one of the faculty here in the nursing department. And I've been here this is my 15th year. I was brought to Carroll kind of by chance as well. I am a nurse practitioner, and I was working as a nurse practitioner and an educator at the local hospital here in Helena, and was invited over to speak at a conference here, and just fell in love with Carroll and started to know the students and kept coming over. And then I decided to stay full time. So it's been a wonderful experience, and I will pass it over to my colleague.
Yeah, so hi, I'm Leah Chavaris. I am also a Carroll College alumni from back in the day, 2005, nursing graduate. So I started my career out in Minnesota, but I did marry a Montana boy, and so we made our way back here. I'm also a nurse practitioner, and Maria here is the one who got me back to Carroll. She started a critical care specialty course that I was able to be a small part of. And I fell in love with teaching, fell in love with being back on campus and working with the students. And so I started as an adjunct in that program, and then one of the lab facilitators. And now I get to teach in the accelerated nursing track for our program.
Thank you all so much for being here. The one thing that we wish we could do is invite all of you to come back to campus, which we always do, but getting you here is sometimes a little more difficult. So we thought that a nice thing might be able to do is give you a brief tour of the nursing department and what's available. It's just a very, very small, minute glimpse of what there is to offer, but I'll go ahead and have Allie start the video.
Welcome to this quick tour of the EL Weekend Nursing Simulation Center. I'm Carmen Williams, Nursing Department Chair.
And I'm Janet Johnson, Assistant Professor.
This new assessment lab is used by sophomore students. This foundational course is used primarily to hone their assessment skills, which are so essential to providing high-quality care to our patients.
This is set up like a primary care clinic where our students work week to week to improve their head-to-toe assessment skills. This is our simulation lab where we have our adult high-fidelity mannequins. This is an area where the students get to practice simulation, which is an evidence-based, proven teaching technique where they work on such things as communication, skills, teamwork, critical thinking, putting it all together. In this space, we're able to manipulate the mannequins to be able to speak through them. Students are able to hear breath sounds, heart sounds, feel for pulses, check pupillary response. So it's a place where they can really gain experience in a safe environment.
This simulation room houses our pediatric, mother, and babies. So the students can learn 2 specialized nursing areas and doing multiple case scenarios.
This is the observation room. It's on the other side of the one-way mirror. We can have views into the simulation lab as well as the skills lab. In here we have nurses manipulating the computers and wearing headsets, speaking for the patients to optimize the simulation experience for the students out in the labs. This is the skills lab, where the students get to come in and work with the task-oriented mannequins. They get to learn skills such as IV placement, wound care, NG placement, suctioning. The benefit of this space is that the students get to come in and practice, which increases their competence as well as their confidence.
This is our debriefing room where we come together after our video recorded simulations are completed, and we discuss what went well, what we could improve on, and what we might want to just do completely different. This area is our holistic lab where we teach the students how to practice self-care. We all need to do that to prevent work burnout and moral injury. We want the students to get used to doing biofeedback using our seasonal affective labs and our relaxation techniques.
Thank you for going on this short tour. We are very grateful for this new simulation center.
Thank you so much, Allie. I appreciate it. Just to let you know, this is being recorded. We had several alumni who wanted to join us tonight who couldn't. Also in advance, they sent in several questions that I'll be asking as we go along for them, and then we'll be recording the answers so that I can get it back to them. But I'm going to go ahead and turn it back to Maria and Leah a little bit to just talk a little bit more about Carroll's program and what it's like today. I do know that we have at least 2 or 3 participants on tonight that are coming from the 60s, the 70s, the 80s, very different than 2022. So tell us a little bit about the program.
Yeah, so we have some very exciting things that are new that are happening here, but I think it's important to talk about we are still rooted in our foundation. So the Carroll College Nursing Program is rooted in holistic nursing care. We believe in caring for the whole person, mind, body, and spirit. So our program was originally based on Gene Watson's theory, the Gene Watson caring theory. And we continue to pull that thread throughout our program today. And we're very excited for that because we feel like caring for ourselves is as important as caring for our patient in the mind, body, spirit, holistic manner. So we want to teach our students how to do that for themselves so that they can pass that on to their patients. And we feel that that philosophy of nursing aligns very well and supports the overall mission of Carroll College as well. So I think that that is something that we've continued for those of you who may be former graduates from several years ago. But new things that have kind of come about is we're very excited that we accept students in direct entry from high school in, as well as non-direct entry. So those might be students that decide to come into nursing after doing a year or 2 at Carroll. And then we also accept transfer students. We continue to be somewhat unique, I think, in that we do offer 3 years of clinical experiences for our students. We get them started in that second year. And so for year 2, 3, and 4 in the program, they're actually already getting involved with patients and getting out into the community in both home health areas as well as in acute settings. And I think interacting and practicing in the clinical setting is really key to learning how to apply that nursing knowledge. And so we continue to foster very positive relationships with our community so our students can continue in those clinical settings. I'm going to pass it over to Leah to talk about another exciting program we have.
Yeah, so brand new. We actually started the accelerated nursing track in May 2021. Our first cohort will be graduating in August, so just a few short months, and then they'll be able to take the NCLEX and join the nursing workforce. So this track was built so that folks who already have a bachelor's degree are able and have decided that they want to become a nurse are able to enter our program. And it is intense. It's called accelerated for a reason. We follow the same curriculum, so they get the same great experiences, but instead of 3 years, we do it in 15 months. So they really are working hard, and they again take the same curriculum that our traditional track does as well. We start again in May and we go all the way through until August. And so really, really proud of our first cohort that started in May. And our next cohort is getting ready to start this upcoming May. So we'll have 2 running, which will be fantastic. And then just to add on to what Maria said, we have this beautiful lab and simulators and equipment. And it's been absolutely critical for us to be able to get through COVID and continue to offer opportunities for our students. But it doesn't take the place of, again, our focus on that holistic care, that our focus on getting students out into clinical situations and remembering that patient-nurse relationship, the importance of touch. This area is amazing, and it is all meant to augment and help students feel more comfortable and competent. We are able to offer a lot of, in addition to task training, really organized and thoughtfully built simulations so that students can practice certain scenarios here in a safe environment. And so then when they go out into real practice, they're able to feel more competent and confident. And we've had really positive feedback from graduates and current students that it is indeed helping them feel more comfortable. So it's really a wonderful opportunity to be in a new simulation lab.
I think another unique and innovative project that we have been working on over the past about 3 to 4 years is the nursing department has partnered with our theater department. And we have theater student actors who actually come in and take on the role of patients in a variety of settings. We have done simulations where it was in the home setting. We've actually used some apartments on campus and had students go in and interact with the theater actor students. We've had them act in roles of patients in the acute setting in the hospital, as well as sort of in the outpatient setting. And these are unique simulations because they allow our students to interact with a real person where they can practice skills like communication, therapeutic communication, teaching, and get that response as if it was a real person, so sometimes the mannequins do amazing things, but sometimes you really do need that real person who can kind of react and you can communicate in a realistic manner with facial expressions, etc. So that is a really unique and exciting program. It's called the Stage Health Simulation. We're very fortunate to partner with our theater department to be able to do that. And the feedback from nursing students has been really positive and how it builds their confidence when they actually go out to communicate with patients in the clinical setting.
Super, thank you both. Just so you know, I'm really multitasking here. I had got a text from, believe it or not, my former roommate at Carroll, who was a nursing student, who said, I can't get on the link. Could you just put it on voice or on your speakerphone? So if you see me looking at my phone, you'll know what's happening. Great. It's now time if people have questions that they'd like to answer, ask either the faculty or the students, that would be wonderful. I did, like I said, have a few people that had questions that would like to be answered. And so I'm going to start it off with just a couple of them, and anyone feel free, if you're comfortable in answering it, Some of them I'm sure will be much more student related, while others will probably be clear for the faculty. And some of them I think have already kind of been answered in your presentation. I think you've talked a little bit about the accelerated nursing program, but more specifically, how do you see that being so different, or maybe it isn't so different from the traditional nursing programs that most people think we offer?
Sure, I'll take that one. So I, again, have the pleasure of working with this cohort. And so really what we're doing is the content is condensed. So instead of having a 1-hour course, they might have a 3-hour course. And so instead of taking courses over 16 weeks, we have 8-week sessions. So in one semester, they're taking 2 different sessions, multiple classes at a time. And then in the summer, we do 6-week sessions. So everything's just very condensed, right? This type of format, we do recommend that folks not try to maintain like a full-time job. So that's tricky, right? These people are highly committed. They know they want to be nurses and they want to be nurses now. And so they're incredibly dedicated, exactly like that is very similar with our traditional track students as well. Yeah, it's the pace that is different, and the classes are a little longer. The days might be a little longer for different reasons. But they still get out and get into those clinicals just like our traditional track. And so I would just say it's the speed of how we're doing things, but really the fabric, the foundation, that is the same.
And just to follow up to that, for my own personal information, is it all done on campus as much as possible, or is it more online?
Yeah, that's a great question. We are on campus. Yes. So it's in line with the traditional track. Carroll College is primarily, we pride ourselves on being face-to-face as much as possible. And so really grateful that the accelerated track also really works to maintain that.
That's great. I think we've already covered this one. The question was, and I'm pretty sure I know who this is coming from, but with this nice new shiny facility that you have that has all these bells and whistles, are you making sure that our students are still getting out there and doing real life practical care?
Yes, that's a great question. I think from a faculty perspective, that's something that we hold really dear, that we love our simulation. It's helpful. It's a great augment and adjunct to our clinical, but it cannot replace in person. So we are accredited through CCNE, and then we also have regulations through the State Board of Nursing that require a certain number of in-person clinicals. So we are well above that number. And we have kind of held to not replacing clinical with simulation. So even through our pandemic, we have done the best that we could. And we do our best to not replace real clinical hours with patients with simulation. Through COVID pandemic, we were limited through 2020 a little bit, but we've been able to kind of resume our in-person to that full extent like we were doing before. So we really use simulation as an augmentation, not as a replacement, which I think we're really proud of in that way. So we definitely need our students out in the clinical setting. So that's why we spend so much time, and actually our director tonight is, I think probably at that same event with President Sec to create partnerships with our community. So our institutions in the community are even our schools to have school nursing, public health, home health, and then our acute centers as well. So that's really important.
Yeah, I concur. Everyone in our faculty, everyone in our team, our administration really supports our vision to continue getting out there and being face-to-face with folks.
Just need to unmute Renee. Thank you.
Will you be having another Carroll College Nursing Alumni reunion? We had one in 2016. The answer is we always love to have a nursing reunion. And if you help me corral all those nursing alumni, I'm sure both the department and myself would love to gather you all back and have a reunion. This one coming into the students, and maybe you both could give a perspective on this. There are lots of options out in the world of nursing programs. Why specifically did you choose Carroll above any other program that's being offered out there?
I can go first. So I was mainly looking at direct entry programs, which Carroll had. I was fortunate enough to apply before the deadline for the direct entry program. And luckily enough, I got in. And actually, the new lab was under renovations my freshman year at Carroll. So I was just like, ooh, new facilities, might be a win. And then also, Carroll had a 100% NCLEX pass rate coming in. And I think we've honestly kept that up my last 3 years here. So that was a big like pull factor for me, and just the small cohorts, just getting to know your classmates really helps, because then you have the support of your students. It's much less of a competition. You're more there to support each other and just, you know, grow and learn together.
I agree. She really covered a lot of the same things that brought me here. Obviously, track and field also helped bring me here. And I actually talked to my coaches when I was coming here about how well the faculty work with athletes' schedules. And I was pleased to find that the departments work really, really well with the extra scheduling that we have.
Super, thank you. I'm going to take another question. Do you all see my screen when the questions pop up? Okay. Sorry, just 1 second, scrolling down. Would the students like to share a thought or two of what about the nursing program they have found most beneficial? Not just Carroll itself, but now being in the program, what do you think has been most beneficial to you?
I mean, I can go first on this one too. You know, this one's gonna take a little bit of a thought, but again, the small cohorts really help, because like you get one-on-one time with your professors, which I know a lot of like my fellow friends that go to bigger programs don't always get. And then the smaller community really helps you like interact with like not only nursing students but also nursing professionals who are also like already working as RNs. I don't know. It kind of helps like being like, oh, I'm a nursing student at Carroll College, and they're like, where is that? And I'm like, oh, it's a small school in Montana. And then just trying to explain your perspective, where you're coming from, kind of gets people interested in your experience. I don't know. It just helps explain where you come from, and I don't know. That was not a good answer, but hopefully Elias has a better one.
Oh, there's no bad answers here.
I'd say that the smaller class sizes are a big benefit that we get. I get a lot of one-on-one time with professors. I can talk to them after class, which from what I've heard about larger schools, you don't quite get that same experience. And then also the increased clinical time, like starting my first semester as a nursing student in clinicals, I felt was really beneficial. And the new facility has been really nice to get some hands-on experience in there, practicing our skills.
Great, thank you. The next question is, do you have nursing students that are also in the ROTC program?
I can take that one. So we haven't had a current recent student in ROTC. They are absolutely welcome to come here, but we actually do have quite a few that are in the National Guard. And so, and we've had students that are deployed mid trajectory. And so we just put a pin where they're at, and we love to stay in contact with them and send them mail. And then when they come back to us, we pick up right where they left off. So Brandy Keeley here at Carroll College is an incredible asset for veterans and our service folks. And then ROTC, again, like they're more than welcome. We just haven't had a recent student, but just like with the sports, we're very flexible. We try and make it work for folks. If you want to be a nurse, we want you to be a nurse too.
Great. That's great. So this question actually dates back to my era when I first started at Carroll. And it used to be that when you were on your OB rotation, you were paired with an expecting mom, and you kind of went through that whole, you followed them through the whole experience, even maybe to the birth experience. Does that still, yes, does that still happen these days, or is it a new format?
That's a great question. We actually have a new format on how we do that. And we have our OB and pediatric rotation together. So we have our students that are actually placed in the acute OB unit, which is our women's and children's unit at St. Peter's. They're able to participate in the actual labor process, as well as possibly take care of acute infants that might be in the NICU, or possibly take care of an acute pediatrics if there's one available. And then we also send them in that same semester, they also go to our Head Start to do pediatric rotation more on the outpatient. So we are not currently pairing anybody with anyone at home. We've kind of talked about bringing that back, but I would love any alumni feedback on how that, what that experience was like. Was that valuable? Should we try and rearrange that and bring that back? But right now we are really happy that we're able to get them into that birthing process and spending time with moms both before, during, and after in that postpartum period.
I'm just going to interject really quickly on this, being one who participated in the program with all 4 of my children. I still stay in touch with 2 of my nurses. And it was a wonderful experience, I think, both for her, but it was a large time commitment because she went to appointments with me. She went to, did a lot of things. So I see the pluses and minuses of it, especially with how busy students are today. But for me, as the recipient of that, it was wonderful. So there's one bit of feedback.
Yes, thank you. It sounds amazing.
So nursing, especially these days, is a really hard profession. Some days are really good. Right now, it's sometimes kind of rough. How are you preparing students for today with some of the really hard things that they're going to have to experience, and how to take care of themselves? And I know you touched on that briefly, and the video touched on that briefly, but could you go a little bit more into that?
Absolutely. I think having one for all 3 years, we have the holistic healing lab, which we try and introduce students to as early as possible so that they can. And in the holistic healing lab, students are welcome to go in at any time. We have essential oils, we have the biofeedback, very simple biofeedback machine that they can use. We have the seasonal affective disorder lights. So we want them to utilize those resources while they're here. We also partner with the Wellness Center here on campus and encourage students. We have something called the Success Plan that we encourage students to use the services on campus throughout their 3 years that they're in our program, which that offers, of course, physical needs, but also for our counseling. But I think what we've seen with COVID, it's really intensified some of the moral distress that what we're seeing. So we've gotten some great feedback from our alumni who have brought that actually to our attention and said resiliency and increasing the resiliency and teaching students how to be more resilient in the new changed healthcare setting is important. So what we've done in our capstone seminar, which we've had in their last semester, is that we have actually focused on resiliency, moral distress. So they do some research, And then they also, we talk about what techniques are available. And actually, this is perfect timing because we actually have a speaker next week that's talking with our capstone students to talk about resiliency and how they're able to possibly increase their resiliency in healthcare. And we talk about what kind of issues they're going to come up against, sort of the ethical issues, and maybe not being able to spend the kind of time and give the kind of care that they ethically would like to give to their patients due to perhaps staffing issues or time related. And I think it is important to talk to students and give them those tools to say, how can you feel good about the work you're doing and do the best you can for your patients and still be able to take care of yourself, and how do you balance that? Additionally, some of us include within our courses prayer in the beginning of a lecture course or meditation, and encourage students to try and utilize those self-care techniques throughout the 3 years so that it becomes a habit for when they leave us and they're able to continue that once they're actually in the healthcare field.
Okay, and next question is, I hear the requirements to maintain in the nursing program are really hard compared to that of other programs. Students, do you feel like that is the case? And maybe to the faculty, why is that? Boy, that's a loaded question.
In my experience, like applying to nursing schools, I was actually looking at those requirements to maintain like whatever the word is, but to like stay in the nursing program. And Carroll's is actually like number wise, like GPA requirements are actually lower than like most schools. I think most schools is like 3.0. Carroll's the 2.75, I believe. But the classes at Carroll, nursing course wise, you have to get a C or higher. And the grading criteria is different than other departments, which was a little bit of a throw off for me because I was just like, my 87's a B minus, okay, but it's personally, I don't think it's more difficult, but then again, I haven't had experience with other nursing programs. But again, all the nursing professors are here to help you succeed. So even if you feel like you're struggling and you think struggling is an A minus, they are more than happy to help you out. So I think just the support that we have at Carroll makes it less difficult than other programs. But then again, I don't have experience with other nursing programs.
I think I'll just add a little bit to that. I love the student perspective. I would say that there are some challenges within nursing versus other disciplines and different majors. I think some of that is related to when our students leave here, they are caring for real people in real healthcare settings as soon as they graduate. Most of our graduates have a job and pass boards within about 6 to 8 weeks after graduation. So we have a lot to fit in those 3 years. Additionally, I think it's challenging because our students are doing most of the time up to 12 hours of clinical a week. So they're not only in classes, but they are also out in the clinical setting 12 hours a week. And that's a lot. It's a lot for all of us to be studying in classes and then be highly functional on those days that you have to be out in clinical settings. The other thing we do that I think is really successful is we spend a lot of time like in small groups with faculty. And I think it's one thing that makes our program really unique. And that's in our lab. So we'll spend a lot of time with smaller groups. So students will have 3 to 6 hours a week in the lab with faculty in small groups, and like usually 1 to 2 faculty to 6 to 12 students at a time, where we're practicing skills, we're doing simulation, we're really getting in deep into subjects. And I think that is truly what can sometimes make our program unique, is that time with a faculty to dive deep into subjects so that students really feel they can ask questions and learn it at a deeper level. So I think when you're adding on 3 to 6 hours a week of lab and then 12 hours of clinical, they're usually taking 2 to 3 nursing classes, which range anywhere from 3 credits to 4.5 credits per semester. And There are other core courses like, we value the liberal arts in our program. And so we are a little bit different than some programs in that we don't have students kind of do all their core and then start nursing generally. Instead, in our traditional program, we want them to integrate those core courses like theology, philosophy, writing throughout their 3 to 4 years with us. And the reason for that is we want them to be around other people who are non-nursing majors. So you can get the perspective of other thoughts, other perspectives of other disciplines, because it will help our students be well-developed, well-rounded, have the different perspectives of liberal arts, which integrate so well with nursing, so that they can truly care for the holistic patient of mind, body, and spirit. So for us, it's really important, but it is challenging, I think, when you compare nursing to some other majors and disciplines. And I think a lot of that has to do with that clinical, hands-on approach. And we certainly don't want it to be stressful, right. But we also value how important it is that our students be, when they're going out to take care of patients, it's real life, it's life and death sometimes. And we want them to feel prepared to be able to do that and feel well prepared and have a really high quality program for them, so that they're prepared to take their boards and truly be successful when they leave here.
I do have to say, for all of our nursing alumni, they say nothing but that they feel so well prepared when they get out into the real life situation, that they're so thankful for all the hard work that they had to put into the program. So you're doing great. I'm going to combine two questions that have come up because I think they're very similar. They're both talking about either your final clinical rotation or your capstone. Can you do it out of Helena, out of state, where maybe you can go back home where you have family, or go to someplace you're interested in and experience in a different environment? Is that available to our students?
Yeah, that's a great question. So several years back, actually the requirements changed. And so we do have partnerships with Idaho. And so we can send students down to Boise, McCall. We have a great relationship with St. Luke's and St. Alphonsus down there. But for the most part, they stay for that capstone in Montana. They do go all over Montana. But because of changed regulations and federal laws and insurance reasons, it's closer to home than it used to be.
Great. So people have noticed either through the video or even behind you, there's different different mannequins back there. Does each have their own special purpose?
We do have a variety of mannequins. So we have some that you see in here, that this is our adult simulation lab in here. So we have very high fidelity mannequins all the way down to more like task trainers. So what you see behind us, these are very high fidelity, meaning they can do a lot of different things. So we can sit in our viewing room as faculty and talk through the mannequins. So we're able to use our own voice and talk through. And the mannequin themselves, they have heart sounds, lung sounds, they have pulses. We don't always put fluids in them, but they can cry, they can sweat, they can even bleed. They can put Foley catheters in there and get real urine, not real urine, just colored urine. And so we can do all those things that really can simulate that real person, but in an environment that's safe, so that students, a lot of times in the clinical setting, our first priority is patient safety and making sure the patient themselves gets good care. And here, what we can allow, we always have a clinical instructor in the setting, making sure that it's very safe and decisions are always kind of monitored. But in here, students can really be sort of allowed to make independent decisions because it's a safe environment where mannequins, if you do the wrong thing and make an error, they're not going to get hurt. But we do learn so well from our mistakes. We learn well from our experiences that it allows students to be able to have a little more independence and kind of build that confidence. We have other mannequins. I don't think you can quite see, but we have another whole area over over here, this is our maternal and pediatric area. So we have some smaller mannequins. Like here is our pediatric mannequin that, maybe about an 8-year-old or so, that allows students to practice. And again, we don't have a lot of pediatrics here in Helena, so it's nice for them to practice that. We have Lucy, who is one of our mannequins, and she is amazing because she actually can be pregnant or not pregnant, and she can actually deliver babies. So students can kind of go through that experience. And then we have a beautiful little newborn here where students can practice newborn assessment. And then away in the corner over there, we also have an infant. So we have different ages for students to be able to kind of practice. So if they can't maybe get something in the clinical setting, we can do what we can to help them feel comfortable in here. But as we've kind of talked about, I think those clinical settings are ideal, and we don't ever want to lose that. But these mannequins can do so much to help simulate that. So even practicing like physical assessment skills and checking for pulses and murmurs and abnormal heart sounds and abnormal breath sounds, bowel sounds, doing skills. These are great. We also kind of have a range of where, for any of you who have been here, you probably know Mr. Gray. Mr. Gray is still with us. He was our very first mannequin from, long before I came. He is still here with us. He is still helping to teach students to do turning and baths and making beds. So just sort of having that mannequin there for more like skills is also important. Then we have things like arms that allow them to practice IVs and get that feel and how to work the equipment before they actually start IVs on a real individual in the clinical setting.
And I just want to brag on our student population for a minute. The life cycle for a high fidelity simulator, one that has chest rise, chest fall, and pupils that adjust however we have them programmed, the average lifespan for that is 5 to 7 years. And one of our high fidelity mannequins simulators, George, we call him George, he's like 14 years old. And yes, and currently he's on a ventilator, he's intubated, he is still running sharp. And that says a lot for the type of students that are coming here, because honestly, we want students to come in and get their hands on the equipment and practice after hours, or if we're not in here teaching, right? So students actually have quite a bit of access, and we encourage them to come in. And so it speaks so highly of the folks. So thank you, students, because we treat the simulators just as if they are patients, and it shows in the care and the condition that keeps them in.
Because I imagine those aren't cheap to replace.
No, they're not.
So for the students, can you tell us what your favorite rotation or experience has been thus far in the program?
Being pretty early in the program, I haven't gone through very many rotations, but I recently completed a rotation with the Hacked Aware program here in Helena, and I really enjoyed that program because they're a community outreach program that works with people living on their own with mental illness, and it was just a really good experience to get to go out there and see people in their own homes and see how they live and what sort of care they need to be provided.
I am also I guess I'm a little further into the program, but I'm in my first med-surg rotation as of right now. And I've honestly enjoyed being on the surgical unit just because we've honestly learned so many skills. And being on a surgical unit, you're able to apply all of those skills you've learned, and you're like, wow, I've actually learned so much more than I thought. And you're like, I could take care of this patient if I was really like supposed to. And it's confidence building, to be honest with you, and kind of ego boosting. But it's just been really nice to know that like I actually learned something, and I'm just not, studying. I'm actually able to do things out as a student nurse. So it's been a good rotation, and I think it's been my favorite so far.
That's great. Thanks to you both. I think we touched on it just a little bit in this last question, but in today's world where mental health care is so important, does Carroll do a lot of exposure to the students about that world and getting them prepared to care for people in mental health issues? I'm seeing, yeah, I'm getting lots of nods, so that's great.
I'll just touch briefly on it. Yeah, I think as faculty, we have that drive to always look for new experiences for students. So we're actually really lucky here in Helena. We still have Dare, that is a renowned pediatric or children's psychiatric hospital. So we can see and have students experience kind of acute mental illness care for pediatrics. So that's like 18 and younger. And we've also been able to establish some partnerships with like the AWARE program, which is out in the community. Acute care is important, but we also want to expose students to outpatient settings to help them understand how individuals will function with chronic mental illness and other chronic illnesses, because that really is important and kind of where the future of healthcare is going. So we have the AWARE program. We also have the mental health center. I can't quite remember what the title of that is. But we're trying to partner with not just acute, but also outpatient and get students out there to experience that. And then the unique thing is we're really fortunate that our 2 acute hospitals actually have behavioral health units within them. So we try and also send students, like in Krupa's current rotation, even though it's med-surg, we will send them to that unit because individuals that are in behavioral health units still have medical problems, and addressing the psychiatric needs of our patients are important in no matter where we are caring for our patients. Because again, getting back to that mind, body, spirit, addressing the mental health needs of our patients, whether they're on OB or in surgical unit or medical unit, is really important. So we're fortunate that both at St. Peter's and the VA, we have a behavioral health unit that we're able to send our students to as well.
Great. And I think this has been answered, but just in case, the question is, are there any clinical rotation opportunities for students to learn more about substance disorders, such as going to the Medical Assistance Treatment Clinic or MAT?
That's a great question. And I think what we have done in the past, and I do have to apologize because mental health is not either one of our specialties. So I will be addressing from what I understand. But if we don't clearly answer, we can certainly get back to you as well. But my understanding is that they do get some exposure through the, I'm blanking out on that mental health Center for Mental Health here in Helena. They'll have that as well. We have had students get exposed to AA by kind of attending meetings so that they can see what it is like, what's offered to assist and support. And then I believe through AWARE, I believe there's also possibly some substance use treatment there as well. We don't necessarily send them directly to like a MAT training, just given sort of their level versus like sort of the graduate level where they're kind of trained at that level, but we do expose them to substance use. And then something unique that we're really fortunate actually that we have a former alumni that comes and speaks to our seniors about substance use in the healthcare provider, because that is, it's a real thing, and that we want our students to know what does that look like when maybe a colleague or a peer actually may have a substance use disorder. What does that look like? What resources are there? How can you notice it? What is your role legally? So they will actually kind of get exposed to that in their senior year in their management and leadership course.
It's really powerful.
Yeah, that's amazing. Another question is, do the nursing students still do anything in the Fort Harrison VA Medical Center?
Yeah, we sure do. So we are super lucky here in Helena, Montana, because We have an inpatient hospital, St. Peter's Health, that's independently owned. It's a community hospital. And we have Fort Harrison that is Veterans Affairs. So yeah, we're really lucky. We send students to both of those inpatient hospital settings.
Great. Another question is, how can alumni best support the work that you're doing today? They're always wanting to do something or support the students or the faculty, and how do maybe any of you see how we can best do that?
Yeah, I think that's a great question too. I think doing exactly what you're doing, right? Showing up and supporting us and asking great questions, so that when you're talking about the program, you have recent facts and faces that you can say, oh, go talk with Maria Brasser, go talk with Leah, right? I think that those are all really helpful things, just being engaged and involved. We love that. As an alumni myself, I love that too. And then I'd love to hear from the students as well. What?
I would just add to that, that we've actually, some of you may be on here that have supported us, but we did bring an alumni panel in to our management and leadership course, each for our seniors, to kind of say, what was it like? So we usually bring back graduates from just the former year to kind of say, what was that transition out of Carroll into the real working world? What was that experience like for you? What would you recommend? And that has been so well received by our seniors to say, what is that like? And they can ask questions about, did you feel prepared? Did you feel like Carroll gave you what you needed? Did you go through a residency program? Did you not? Would you recommend it? What are the tips and tricks that you would give to new graduates? And I think that's been really helpful. I think the other thing, just from a faculty perspective, and I think Terry John is on our call here tonight, and I'm going to put a plug in for her. She is always sending out alumni surveys. So please fill those out. So we send them to graduates after they've left for a year, and then we send another one out in 5 years. And that feedback is so important to us. So we really appreciate that. And at any time, so anybody who has feedback about our program, an alumni, what went well here, what should we continue, and what would you suggest? Like, for example, I was reaching out to alumni in the summer because we were going through our accreditation and I needed some feedback. And we needed, they joined in our accreditation response and met with our accreditors to talk about their experience, which was a great help. But one thing they said is they talked about the moral distress. They talked about resiliency. And because of that feedback, we've now increased it in our program. So it really is valuable. We value what our alumni say and what they say, this worked, this didn't work, we like this, keep this. And so any feedback like that is more than welcome, and we really appreciate it.
Definitely. And while she was speaking, I thought of a big one, precepting.
Yes.
If you ever want to precept, we are always looking for fabulous nurses to pair our students with. So precept, and again, just idea sharing, and hey, we're doing this here. I saw this simulation there, send it our way. And
we also hire clinical instructors. So who can take our students into your expert areas. So if you're ever interested and you're in this area, please let us know.
Thank you. I do know that we're now at 7:30, and I told people that we were going to try to wrap up in about an hour, but there are still a couple questions. If the panelists don't mind, a couple more. You okay with that? Students, you okay? Okay. There has been some talk about the Carroll starting a nurse practitioners program. Is that real, and do we see that in the near future?
Yeah, another great question. So pre-COVID, that was on the doorstep, really. We were interviewing candidates for a nurse practitioner program. We were looking at candidates to be a director that would help build it. Right now, we put our focus on our current students and the accelerated track students. So it hasn't gone away. It's just taken a backseat for the moment while we got through the crisis period from COVID. But I would say it's on the horizons, and we have some really interesting and exciting partnership opportunities happening with St. Peter's, with some possible buildings happening on campus. And so there's a lot of options in the next 5 years-ish.
The future is bright, right?
Future is bright.
So for the 2 students who are on the panel, could you tell us what you would say to a student if they were considering coming to the Carroll College nursing program? On the spot, you're being put on the spot.
I'd say that it's a great program. You get a lot of great one-on-one time with the professors, and all of the faculty really does care about you. Everyone wants you to pass in this program. It's like, it might be a tough program, but everyone wants you to succeed. And for anyone that has extracurriculars that they're interested in, they do work really well with all of that. And really, it's just a great community here.
I agree with everything he just said. So, I mean, do it. There's a good community. There's really good support. And I mean, if you have any concerns, like everyone here, students and current faculty are willing to help and talk you through it. So it's just a good place to be.
Great, thank you. And then I'll just try to wrap up. I'm sorry if we don't get to everyone's questions. I'm so excited that there have been so many. So thank you very, very much. But the other one question that I think is great is, any thoughts of partnering nursing students with alumni? This way, the nursing students can learn about career opportunities such as ER, nursing ICU, public health, etc. I know that's been done in different kind of programs, and would you consider doing that here?
Yeah, that again, really, really great question. So our nursing students aren't paired one-on-one necessarily with, like, you're going to be with an ER nurse, but they do get those experiences and exposures in their out rotations and then their clinicals. So they will have an out rotation with an ER, in the ER, the ICU, the behavioral health units. I'm just trying to think. Public health, we have an entire semester of public health community nursing where they go out and they are, have clinicals with school nurses and Lewis and Clark, county health department, those types of things. So we also, in a lot of our classes, will have guest speakers come in frequently from different specialties, different areas, from all over the country, really. We're really lucky that we've got good connections. And oftentimes they are alumni, which is great, and sometimes they aren't. Just to give those different perspectives so that there are lots of opportunities to see that, you know, there's, we even have like folks from informatics and those other places that maybe you don't always think of as nurses being present and critically important in that. And I don't know if you have anything to add to that.
I would just say we did do this program. It's kind of called a funny name. We would call it the BS and Beyond, meaning the Bachelor of Science and Beyond. And we would bring alumni from a variety of areas to speak in a panel to our students. So we haven't really done, I'm not sure if the individual is kind of referring more to like a mentoring where you could pair a one-on-one, which I love that idea. That I think that would be great. I think the only thing that we have done similar is we've done the panel where we've had former alumni speak about different areas, especially unique areas that students don't always get to see, like Leah had mentioned informatics, or what can you do with your bachelor's of science in nursing that is that students don't even think about. So we brought in someone like forensic nursing to be able to talk about that. We've brought in individuals, of course, from graduate programs, nurse practitioners and educators, but also school nursing. And so bring in the variety, being a nurse in a correctional facility, you know, some unique things that students may not even know is out there. So I think students have enjoyed that panel. And we have done that again as seniors. So that they're able, and we've also done it sort of in combination with our CCSNA in the past, which are Carroll College Student Nurse Association, so that more than just seniors could actually attend and sort of get ideas early on for ideas for their capstone. But I love the idea of a mentoring program. So yeah, I mean, if we have alumni that might be interested in that, if we could get enough, that would be wonderful. Enough students and alumni would be great to kind of mentor through the program, like hang in there, you can do this. It would be great.
So see alumni that are out there, there are ways to stay involved. So you might be able to sign up anytime soon. There are a few more questions, but like I said, I know I made some promises of getting out in an hour. And so I just want to say thank you to all the attendees for being with us tonight. I do appreciate the fact that you're here. I will send this out to those of you who couldn't be. And then to our wonderful panelists, thank you so much for sharing your insight, your knowledge, answering some maybe tough questions or hard questions or exciting questions, and just giving up a little bit of time to be with us. So thank you so much.
Thank you so much for having us. And I want to thank the students. We love your perspective as well. And I know you guys are busy, so thanks for joining us tonight. And thank you to all the attendees and alumni and everyone who joined in tonight. I had fun.
I
It
did
was great.
too.
Oh, good. Good. We're glad.
Yeah.
And there might be some more questions coming your way that I'll have to email you that we didn't get to. So thank you, everyone. And I hope you attend the next program. Good night.